Imagine having a kidney disease that for years had almost no real treatments. And then, in a relatively short space of time, suddenly has 6 new approved drugs. That's what's happening with IgA nephropathy right now in 2026, and honestly, it's one of the biggest and most hopeful shifts we've seen in kidney medicine in a long time. So, what exactly is IgA nephropathy? It's also known as Berger's disease. It's an autoimmune condition. Your body naturally makes a protein called IgA to help fight infections, especially in the throat and gut. But in this disease, the body starts producing a slightly abnormal version of that IgA. These abnormal proteins begin to clump together. They get stuck inside the tiny filters of your kidneys, the glomeruli, and slowly cause inflammation and scarring. Over time, those filters stop working as well as they should. The kidneys start leaking blood and protein into the urine. Kidney function gradually declines. It's actually the most common primary glomerular disease in the world, and it often shows up in people in their teens, 20s, or 30s. It can affect anyone, but it's seen a bit more often in men and in people of Asian or Caucasian background. The tricky part is that IgA nephropathy is quiet at first. A lot of people don't notice anything unusual for years. The first clue is often cola-colored or pink urine that appears during or shortly after a cold or sore throat. Some people just have microscopic blood in their urine that only shows up on a test. Later, you might start noticing swelling in the legs or ankles, rising blood pressure, and a slow but steady drop in kidney function happening quietly in the background. Because the early stages can be silent, many people are diagnosed later than they should be. Without good treatment, a significant number of people eventually progress to kidney failure. That means dialysis or a kidney transplant. For a long time, the best doctors could really do was control blood pressure with medications, recommend lifestyle changes, and sometimes use steroids, which, as many people know, come with their own set of side effects and risks. Until about 2021, there was basically no treatment made specifically for this disease. Supportive care was the main approach. Now, in 2026, the picture looks very different. We suddenly have several options that actually target what's going wrong in the disease process itself. We're no longer just managing symptoms. These are real disease-modifying treatments. And that changes everything for patients. Let me walk you through the main new ones in a clear way. First, there are the APRIL and BAFF inhibitors. These work higher up in the immune system. They try to reduce the amount of abnormal IgA the body is producing in the first place, which is one of the key drivers of the disease. One of them is sibeprenlimab, sold as Voyxact. It's given as a monthly injection and specifically blocks APRIL. The 2-year data has been really interesting. It showed that this medicine can stabilize the decline in kidney function, in some cases bringing the rate of loss close to what we see with normal aging. That's a meaningful shift. Then there's atacicept, known as Trutakna. This one blocks both BAFF and APRIL. It's given as a weekly injection. In the clinical trials, it did a solid job of reducing the amount of protein leaking into the urine, which is an important marker of how active the disease is. Next up is the complement side of things. Iptacopan, or Fabhalta, is an oral tablet taken twice a day. It blocks part of the complement system, which is another pathway that amplifies inflammation and damage in the kidney. It recently received full FDA approval after showing that it can meaningfully slow how fast kidney function is lost over a 2-year period. There are also options that don't suppress the immune system as broadly. Sparsentan, known as Filspari, and atrasentan, known as Vanrafia, work on the endothelin and angiotensin pathways. These medicines help reduce protein in the urine and protect the kidney without shutting down large parts of the immune system. For some patients, that can be a real advantage. And there's also targeted release budesonide, called Tarpeyo. This one works more locally in the gut, which is believed to be where a lot of the abnormal IgA production begins. It's another tool that doctors can consider depending on the patient's situation. So in a pretty short period of time, we've gone from almost nothing to having a real set of treatment options with different ways of working. How do doctors decide which one to use? They look at several things: how much protein is spilling into the urine, how fast the kidney function is dropping, the person's age and overall health, other medical conditions they may have, and how comfortable the patient feels about stronger immune-suppressing medications. Many people still start with good blood pressure control and supportive care. Then, if they're at higher risk of progression, one of these newer treatments is added. In some cases, doctors are also exploring combinations, though that research is still ongoing. Look, this is genuinely good news. For the first time, people living with IgA nephropathy actually have options that can change the direction of the disease rather than just slowing it a little. That said, it's important to stay realistic. These medicines are still relatively new. We're continuing to learn about their long-term safety and benefits. Cost and access can also be real challenges for some people depending on where they live and their insurance situation. The most important step is always to have a proper conversation with a nephrologist who is experienced with glomerular diseases. Not every treatment is right for every person, and the decision should be personalized. IgA nephropathy went from having almost no targeted treatments to becoming one of the most active and rapidly evolving areas in kidney medicine, all in under 5 years. That pace of progress is rare. If you or someone you care about is dealing with this condition, the picture in 2026 looks very different, and honestly, a lot more hopeful than it did just a few years ago. There's more reason for optimism than there used to be. If you found this video helpful, please give it a like and subscribe to Cerevora Wellness for more clear, honest, and practical health information. And if you'd like me to go deeper into any of these specific drugs or into practical steps people can take while living with IgA nephropathy, just drop a comment below. I read them. Thanks for watching.